ka di-sina. But he's just a young boy. Waka kitima mmengwaga ya go se fete 25 years. Ke tswa ka lapeng ke sello fela because re ba ikemiseditse go bona ke digolo ka moshimanyano o ba sa tsenye motho o ba sa lapiše motho. And as a forum ya ka seshego, we are very angry now. Re ya tuka o ka re batamela ngani ya ka bona motholo.
That is the voice of Victor Makura. Victor Makura is the spokesperson for the Seshego Community Against Gangsterism Forum. Essentially saying there that the case of this young man is that he's suspected to had gone to Seshego Zone 5, where it seems that he was a victim of robbery that went as far as leading to the loss of his life. Essentially, he's saying there that they're tired. It would be remembered, really, that Seshego has battled for some time now a challenge of gangsterism that leads to the unfortunate passing of young people there. So, as you could hear in Mr. Makura's voice, they're very frustrated to continue to learn of cases such as these. We leave it there and we move straight to talking female health. Coming up next.
Conversations with Rebecca Pala.
The time now is 23 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. It's time to talk all things female health with our resident gynecologist, Dr. Maluleke, who joins me now in studio. Start sending all your gynecology-related questions. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212, or you can send a voice note to 060-771-5107, 060-771-5107. You can also give us a call, and this is how you can do that.
Have your say. Call us now on 015-151-1058.
015-151-1058. That's the number to dial. Dr. Maluleke, good evening. Welcome.
Good evening, Rebecca. Good evening to our listeners.
Are you well, Doctor?
Well, and you?
I'm well, thank you. Let's begin by just talking about discomfort that people will have around their female genitalia. But perhaps before we do that, please note the views expressed in the following segment are not suitable for listeners under the age of 18. I saw a picture that is being circulated widely on mostly WhatsApp, Doctor, showing a young woman whose female genitalia has developed something that looks like a mushroom.
Yes.
I don't know if you've seen the picture.
I've seen that.
Mm-hmm. And people obviously have different theories, the kind that we wouldn't particularly entertain and talk about here because it would require some expertise that I don't think either one of us has, because there's issues of spirituality that people are talking about. But I want us to, looking at that very picture, talk about discomfort that seems to have a permanent effect of sorts that revolves and develops around the female genitalia. Talk to us just generally around that.
Right. Well, speaking about that particular picture, in actual fact, that woman is having warts. Those are genital warts that have overgrown. And they're a result of the human papillomavirus infection. But for them to grow to that extent, often there will be some degree of immunosuppression. In other words, there could be HIV as well. I would bet my bottom dollar that if she was to be tested for HIV, if she is not tested, it's likely to come positive. That is what will drive the size of those lesions. However, for them to grow to that extent, it means it's been a while. They've been there for quite some time. And it's a great shame indeed for someone to be walking around with lesions such as those and not take action, because they started being small. For them to grow to that extent, excuse me, they started being small, and had she taken action at the time, they would not have grown to the extent that they have done so. We see this often, even with cancer of the cervix. People stay with symptoms and even signs that something is not right, but they don't go out and seek help. And by the time they do so, in fact, that's when they no longer have a choice, because look at those lesions that you are talking about. They are so huge that she can't even sit properly anymore without her feeling some degree of discomfort. They are friable lesions, meaning that they will bleed on touch. Every time you touch them, they will be bleeding. So then it forces her to take action. But those are actually warts. And this is also based on the upbringing. People, we all know that the genitals are private parts, and therefore they are not to be displayed. And because of that, people don't even. There are women who don't even know how their genitals look like. They don't even bother to go and have a look, and because this is private. And some couples also. I will tell you of an experience I had in 1986. I was in a hospital somewhere in the Nebo area where this woman who was coming to remove the stitches after she was sterilized, having had a cesarean section or sterilization rather, in the then Joburg General Hospital, 30 years old. And I said to her, "Oh, finally you've decided, you and the husband have decided to close shop." She says, "No, I decided by myself." And then I ask her, "Doesn't the husband know?" She says, "No, he doesn't." And what will happen when he sees the scar? She says, "He will never see it because my husband has never seen me naked." All right? When we go to bed, we switch off the light. One goes to sleep first and the other one follows. He has never seen my body naked. So there are situations such as those where people sleep with each other and yet they don't know how their bodies look like. I'm not sure whether that is cultural or it's a sign of respect, because apparently women should not even see their spouses naked because they will not respect them. Something of that nature. Yeah.
In that picture, we're talking about that young woman is said to be using adult diapers now.
Probably because there is immune suppression. When you have HIV in its terminal stage, you will have incontinence, both of urine and of feces, and you will need diapers to assist that. So, I even listened to a voice clip that apparently comes from her, claiming that she slept with a man from Nigeria, and she thinks he's the cause of her problems. But in actual fact, she had a sexually transmitted infection, which caused the warts, and probably because of the immune suppression, the warts grew to that extent. I have been asked by a daily publication to comment on that. And they sent me the pictures and wanted me to say something. And I said what I said. I have not seen their publication, but it's a newspaper that is published daily, and they asked me to comment on that.
Can she be assisted?
It can be. She can be assisted. Firstly, she will need to have the HIV test done, and she'll need to be put on the antiretrovirals. Once the immunity starts to function well, the lesions may even shrink, but they can be treated both medically and surgically. But the ones she has will need some form of surgery. You cauterize them, and from there she goes for regular checkups, and ultimately they will go away. But she will remain with a lot of scarring in the genital area, but they can be treated.
Okay. Let's go to questions in our WhatsApp line. We'll start with this one. I'm sure you will agree with me to say it's one of the most famous questions that come about every once in a while. Doctor, good evening. I see a lot of women these days using vaginal steaming. What are the advantages and disadvantages?
The question that we get every week. Vaginal steaming. Right. Like I said even last week, none of us, the doctors, will encourage anyone to do that, because it does not achieve any of the things that it is claimed to be achieving, particularly with regards to fertility, with regards to cysts, with regards to fibroids. Those claims are preposterous. But there are people who apparently find relief from period pains after the steaming. The danger thereof would be the disturbance of the vaginal environment. As you know, we always talk about the delicate balance in the vagina that will maintain the health of the vagina. Now, when you put steam in there, you're disturbing this. And this will then lead to a number of any infections that are undesirable. Secondly, the genital area by its nature is very sensitive, and it is easy to suffer burns as a result of this practice of steaming. So for that reason, all of the doctors that I know will not recommend it. I know it is offered in some spas or steaming or saunas where people go for steaming, but those people are in business. It's the same as anybody selling cigarettes. They are in business, but we know that cigarettes have no health benefit. Instead, they cause a lot of trouble, but it is a very serious business. One can go on and on. Alcohol, for example. During the lockdown, people even threatened to go to court. But we who work at the coalface, we had seen how much the lockdown or the prohibition of alcohol had reduced the workload on the hospitals. There were far less people who came with violence or injuries as a result of alcohol. So, and yet it is out there. It is being sold. So it does not mean that anything and everything that people sell may benefit you.
Okay. Let's take a voice note. Doctor?
It is not permitted. That is not allowed. The law requires that the two parents need to give consent for the test to be done. All right. So if he did that, he can do it, but most of the laboratories will not agree to do that. If they did it, they will also be breaking the law. It has to be done the legal way, wherein the one who's disputing paternity should be able to carry the cost. He is going to pay for himself and pay for the child. And the mother needs to give consent. This is a requirement in our country, unfortunately.
All right, this is how you can get in touch with us. If you would like to ask a gynecological question, our WhatsApp text line is 079-295-1212, 079-295-1212, or you can send a voice note to 060-771-5107, 060-771-5107. Alternatively, there's also the option of giving us a call. The number to dial is 015-151-1058, 015-151-1058. We continue answering all of your questions after the break.
Have your say. Call us now on 015-151-1058.
Your attention, please.
Hello there, can you hear me?
Please stand by.
The fact that we are hearing this voice means that local radio advertising works. Use the power of Energy FM to reach thousands of potential customers in Polokwane, Seshego, Tzaneen, Leboagomo, Mangwe, Mukopane, and other areas within our broadcast footprint. Increase brand awareness and improve your sales with our variety of low-cost monthly packages designed for small and medium businesses. It's cheaper than you think. Our aim is to help your business to grow. Contact Energy FM Sales now on 015-151-0039. 015-151-0039 or email sales@energyfmsa.co.za, sales@energyfmsa.co.za for a quotation. This limited offer is only available to local SMMEs. T's and C's apply.
Bust the hunger with African food, delicately prepared by
What is
MTJ
this?
African Cuisine.
Just quickly.
But it doesn't end there. We offer catering services for wedding, corporate events, baby showers,
thing. I'm
all other
on
types of
what?
gatherings. Our range of South African cuisine is tantalizing and affordable.
I'm
For
on
more info, call our WhatsApp
XARELTO.
067 064
Zarelto.
043
Zarelto. It's a thing. Can we say it on air?
9784.
What is it?
Visit 63
It's
Box
a-
Street, Polokwane. MTJ African Cuisine. Your
It's an
craving is our
anticoagulant.
service.
Come to Nictas Furnitures for a wide range of lounge suites to TVs, from base sets to bedroom suites.
Also
from dining
doubling
room
up
suites
as
to
a
fridges,
pain
and so much
medication.
more. Visit Nictas store at 68 Hans van Rensbeck Street, Polokwane, to see our latest monthly specials. Nictas Polokwane, where you will find quality,
doctor?
value, variety, and
Zarelto. Zarelto.
Are you
There's a tongue
experiencing
twister
blurred
every
vision,
week on
headaches,
this
or
show.
painful
Yeah,
eyes?
well,
Spectacle Hut can help
medical
you.
terms
We
are
offer
very,
full comprehensive
very,
eye examination
difficult
at
to
affordable
pronounce.
prices. Branches
like-
in Polokwane, Thornhill Shopping Center, and Library Gardens. Also in Thoyando, Makado, Malamulele, Giyani, Elam, and Mosina. Take advantage of the following specials at all our branches. Buy one, get one free, 20% discount on frames, lenses for pensioners, and Wellness Wednesday packages from 950 Rand. Visit spectaclehutsa.co.za or call 015-291-2920 for appointments. Spectacle Hut Optometrist. We are more than just eyewear.
As we travel to work or to see family or friends, let's not forget to keep the windows open all the time so we can protect each other from the coronavirus. Mzansi, akuti who in the car, train, bus or taxi? We know it's not easy, especially as we approach the chilly season, but let's keep it safe. So continue to follow all the protocols because together we can fight the spread of the coronavirus. The Solidarity Fund, Unity in Action.
Conversations with Rebecca Pala.
The time is 7 minutes to 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. I'm in conversation with our resident gynecologist, Dr. Maluleke. And as always, it's an open line, and that means you are given an opportunity to ask any question that has to do with gynecology. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212. 079-295-1212. Our voice note line is 060-771-5107. 060-771-5107. And this is how you can give us a call.
Have your say. Call us now on 015-151-1058.
Let's say good evening to Anonymous joining us on the line. Anonymous, good evening. Welcome. Ronald Guy, Anonymous. The doctor is listening.
All right.
Is it clear, doctor?
Yes, it is clear.
Anonymous, you listen on the radio for your response? All right.
The likelihood is that the listener has got bacterial vaginosis, which, as you have heard on numerous occasions, is a result of the changing vaginal environment as a result of hormonal activity. You've got bacteria in the vagina whose function is to maintain the integrity or the health of the vagina. But because of hormonal activity, during certain times, you've got an overgrowth of this bacteria. And it affects, these hormonal changes will also affect the pH. The normal pH in the vagina ranges between 3.5 to 4.5. And when you are sexually aroused and during menstruation, the pH tends to be elevated. When you've got elevated pH, the bacteria then overgrows, and there will be secretions of certain chemicals, what we call amines. Then the amines give the kind of smell that the man is complaining about. It is not a sexually transmitted infection. And when we give treatment to women who have this, it's not necessary for the men to be treated as well. There is no link between bacterial vaginosis and HIV. Yeah, well, it's a pity that she's taking ARVs and she has not disclosed to him that she is positive, because then it probably means they are also not using protection. Without the use of protection, he's at risk of being infected himself if he is negative. Although we know that transmission from woman to man is not as efficient as transmission from man to woman. In other words, in couples that are zero or discordant for seroconversion, where one is positive and the other is negative, the desirable one is the one he's describing when she is positive and he's negative. However, if they have intercourse over a longer period without using protection, ultimately he will get infected. But if she has been on ARVs long enough and there is complete suppression of the virus, then the risk of him getting infected will even be smaller, particularly if he is circumcised as well.
Okay.
Right.
Let's take a voice note now.
Yes. If she has been on, she has had unprotected intercourse, this period was delayed, then she bled and there is discomfort. Obviously, pregnancy is on the cards. And the fact that she's got pain, it could also suggest that the pregnancy is actually not normal. She may be having a miscarriage, or she could even have an ectopic pregnancy. Therefore, she needs to do the simple thing. Go and get the pregnancy test done. But now the fact that she's on Nuristorate could also be the reason why the period was delayed, because people on Nuristorate, which is the 2-monthly injection, tend to have menstrual disturbances. I'm not too sure how long she's been on this injection, but there are not many people who will have normal periods when they are getting the injectable for conception.
Okay. Let's say good evening to Anonymous joining us on the line. Anonymous, good evening. Hi,
good evening, ma'am.
Talk to us.
You have intercourse during menstruation. Okay. Except that you will have soiled linen, there is no problem in having sex during menstruation. The blood might soil your linen, but health-wise, there is no problem. Right.
Thanks, Anonymous. Okay, let's go to the WhatsApp text messages. Good evening, Rebecca and the doctor. I have a question. I'm a 33 years old female. I'm trying to conceive. I bought fertility pills, which are called Fertipil Plus. Do they have any side effects to my man's performance and erection?
No, they will not affect the man at all.
Why would one think that they would, though?
It's one of the myths, Rebecca, that when women take certain medications, they may actually manifest in the men. I often tell my patients, or I tell people that, it's like me or you eating bananas, and I'm the one who's going to get the diarrhea from eating
Sure.
the bananas. The belief that when women use contraception, the injection, the pill, somehow it gets its way into the man's body, it's a myth. And I think it is the same thing that this listener is talking about. She's taking the pill for fertility, and the man suddenly experiences a weak erection. You know why this may be so? This is because, and we see that very commonly, women take fertility drugs, and they know that they've been fixed as far as that is concerned. Then there is a time during which, after taking these tablets, the couple is then expected to engage in intercourse. The woman would say, I am ready. I have taken medicine. I'm ready. So you make sure that I fall pregnant. The man then finds himself being pressurized. And if it doesn't happen, oh, it is you. Mina, I have taken medication. And the medication has worked on my ovaries. You are the one who's failing to make me pregnant. So the man is literally on the stage. And because he's on the stage, the anxiety thereof affects his performance. I have had several couples where I give them this medication, and she comes and she says, Doctor, we did nothing because he just couldn't get it up. He just failed to do so.
Only to find that it's the pressure.
The pressure. Because now, she says, no, Dr. Maluleke has fixed me. Paul is in your court.
Okay.
Paul is in your court now.
A voice note.
And doctor, I just want to ask on behalf of my wife, during sex, when we are having sex, always there are some things that come out inside the vagina, looking like a porridge. I don't know what are those things. And always when we are having sex, those things come out. There are white, looks like porridge. What might be the problem?
There might be no problem. You know, Rebecca, the other myth is that during sex, women need not lubricate. All right? They need not lubricate, and when they do so, sex is unpleasurable, something of that nature, which is why people will go out to do all sorts of things to cause vaginal tightness and dryness so that the men enjoy sex better. But, you know, a happy vagina is a wet vagina, and a wet vagina will have secretions. So you will find that this is what he's talking about. During sex, there is this white stuff that comes out, and it just will not be a problem at all. Unless, of course, the wife or the woman has thrush. But thrush will not be porridge-like. It will be like cottage cheese or sour milk, if you like. In medical terminology, we call it curd-like. But it will be itching. Sex will be uncomfortable for her. But if sex is not uncomfortable, there is no itchiness. What he's describing is actually normal. It's a normal response, the woman's normal response to sexual stimulation.
Okay.
Right.
Good evening, doctor. I'm 37 years of age. I've done sterilization back in 2019 in June through personal reasons, and since then I'm seeing my periods non-stop. It can stop for 3 days and then it will come back again, and I want to know if I can stop them completely and if I can change to have a baby if I reverse, because I want to have a baby. I lost one child. Thank you.
Very common situation that we encounter every now and then. Even yesterday or a day before yesterday, I had a lengthy discussion with a lady when she was asking about sterilization and whether in the future she'll be able to have babies. The listeners need to note that sterilization is a permanent form of conception, right? When you decide on sterilizing, you're saying, I am done. I often say to them, you need to try and project into the future when you decide to sterilize. Basically, you are saying, even if my personal circumstances change, I'll still be satisfied. What are these circumstances? One of them is the one she has mentioned. You can lose one of your children, or you can lose all of your children. I had a patient in Mankweng Hospital a number of years ago. She comes in, she's 45 and she wants reversal of sterilization. She had 5 children. Now, these children were on a trip from a funeral, and outside Polokwane, the car capsized and all of the children died. 5 children died on the spot, and she wanted to reverse the sterilization. This is one of the things that can happen. It's uncommon to lose all the children, but you can lose one of those, or you can lose your husband and meet somebody new who wants to marry you, and we see that commonly. Sometimes he divorces you, and you meet someone, or you divorce him and meet someone who wants to have children with you. All these things must be taken into consideration when you decide to sterilize. Some of them do so because they're single, and it is a perfectly acceptable reason to say, I am a single parent, I've got 3 children, I am done. Soon after sterilization, you meet someone who wants to marry you. So, sterilization is permanent. Our listeners need to understand that. It can be reversed, though, but reversal does not have very good results. Instead of reversal, I would urge the listener to consider in vitro fertilization, or IVF, wherein, without being operated, they will get her eggs and use the partner's sperm to fertilize those eggs, and she can carry the pregnancy. But reversal, I would not, at her age, particularly 37 years, I would not urge her to do so. But I need to go and have a look, try and address the menstrual problem she has described. She says since she's sterilized, her periods do not stop. And she attributes this to the fact that this could be due to sterilization. It's not a very common side effect of sterilization. What we know, and we touched on this last week, what we know is that women who have sterilized tend to experience menopause a bit earlier. Okay? They have early menopause. But the bleeding that she's describing, the dysfunctional uterine bleeding, is often not a feature of sterilization per se, but it could actually be abnormal ovarian function. So she needs to go and be investigated as to why the bleeding is doing what it is doing.
All right, our WhatsApp text line is 079-295-1212, 079-295-1212. Our voice note line is 060-771-5107, 060-771-5107. Doctor, what causes bleeding sometimes after sex? A question from Anonymous.
Right. That is what we call post-coital bleeding or contact bleeding. And we also need to emphasize once again that sex did not need to bleed. You do not bleed as a result of sex. When you do so, we as doctors worry about cancer. There are many reasons why people can bleed, but cancer is the one that worries us, especially cancer of the cervix. So when we go and investigate, our focus will be on excluding cancer of the cervix. What are the other reasons why people can bleed other than cancer? One, there could be a growth that is called a polyp. A polyp is a benign growth that often protrudes through the cervix and is highly friable. Friable meaning that when it is touched, it will bleed. All right. 2, there could be even thrush itself because it causes inflammation of the lining of the vagina. You can bleed easily. 3, there could be menopausal changes. With menopause, the vaginal lining tends to thin out and it is therefore easily traumatized. Lack of lubrication, the one that we talked about earlier on. When people rush the process of intercourse before there is sufficient lubrication, they go and have sex. You can cause abrasions and you may lead to the woman bleeding. And sometimes when you use, particularly the injectable, when you use the injection, some of the people will experience this as a result of them being on the injection. They will bleed.
Okay.
Right.
Doctor, I was preventing for 2 months now. I have experienced pains before injections as well as after. So I stopped preventing. Now I want to see my periods. What can I do to bring them back?
Right. If she has been on the injection and she has not been menstruating, the quickest way of bringing the period back would be to try the pill. we often give them a pill for a period of 3 months, and after 3 months we stop. The pill will necessarily lead to her having a withdrawal bleed. Once she has used it for 3 months, we stop. We expect her cycle to have normalized, and from there on, she can even fall pregnant when she's ready to do so.
Okay. Anonymous says, good evening, good people. This week around, I'm about twins. We're expecting them, so I'm very curious about them. Basically, what is the percentage of single-gender twins? Secondly, what are identical twins? Lastly, my dear experiences itchiness in her vagina, which affects me when we have intercourse. Is there potential to have after effects thereof?
Starting with the last part, itchiness, definitely a result of thrush. And thrush, very common during pregnancy because of the hormonal activity. So she can easily go and get treated, but it will recur because of the pregnancy. At some point, she will experience it again. Now, twins and twinning. I told you previously that when I was in the teaching hospital where I trained, I took care of twins. And my research was also in twins. So twins are a passion of myself. There are two questions. What is the percentage of same-sex twins, and what are identical twins? The percentage of twins and twinning will differ from ethnic group to the next. The highest number of twins in the world is recorded in the Nigerian Yoruba tribe, where almost every family has twins. Here we are talking about the non-identical twins, what we call dizygotic twinning, wherein a woman produces 2 eggs per cycle, and these eggs get fertilized. Right? When we come to South Africa, the highest number of this type of twins is recorded in the Zulu nation. Right? The Zulus have a higher incidence of twins compared to the other nations, right, or ethnic groups. Now, when we go to monozygotic twins, the identical twins, the incidence seems to be the same throughout the human race. However, there is a slight increase in this type of twinning in the Asiatic tribes in Asia. The Japanese, the Chinese, and so on. They tend to have more identical twins than any other person. But when it comes to other areas, we all stand a good chance of getting this type of twins. Because there, you've got 1 egg and 1 sperm. And for some reason, after fertilization, this egg then splits, it divides, and gives 2 individuals that are a mirror image of each other. As to what triggers that, nobody knows. And these would always be identical, and they will always be same sex because they come from the same sperm and the same egg. But even the non-identical twins sometimes can have the same gender. And I'm sure you may know twins that are sisters or brothers, but they don't actually look alike. They come from different sperms. They share nothing in common except the journey. Whereas the monozygotic twins, the ones that come from 1 egg and 1 sperm, will always be identical and will always have the same gender.
Okay. Good evening, Dr. Rebecca. 1, I'm currently 4 months pregnant. I would like to ask if it is possible for me to drink wine once a month. 2, is the 6-boosted tablet or drops safe for a pregnant woman? 3, since I became pregnant, I've realized that I'm sexually active or have more interest than my man, and my man is scared in doing other styles with me during sex because he thinks he will have the baby. Please help. The listener says they are 34 years old, and they go on to say, I'm currently 4 months pregnant, and last time during 3 months when we engaged sexually, I then realized that a lot of blood was coming up after we were done, but it lasted for roughly 30 minutes. But I'm still pregnant. What might be the cause? Please help.
The listener has a lot of questions, and it's a bit difficult for me to recall some of them. But starting with the first one, which I remember very well, whether she can drink wine once in a month. We do not encourage any pregnant woman to be taking any amount of alcohol because it is very much dangerous for the unborn baby. Okay? We have the shameful label as a country where we are said to be having the highest incidence of fetal alcohol syndrome in the world. In other words, we have the highest number of pregnant women drinking during, I said pregnant women drinking during pregnancy. This incidence is the highest in the world and the highest in the Western Cape. So we don't encourage women to be taking alcohol during pregnancy. 2, she says the sex boosting tablet that is taken, whether it is safe or not. I'm not sure who is taking the sex boosting tablet here, whether it is her or the man. It's important.
She goes on to say if it's safe for a pregnant woman. Let's assume that it's her that's taking it.
Which one is that? Because the sex boosting tablet that is known and has been approved is for men.
Yeah.
The others are claiming what is neither here nor there. All right? So if it is the man who's taking it, there is no danger for her and her unborn child. 3, she is saying she seems to feel more sexually, she has more desire during pregnancy. This is not unusual, Rebecca, because it's a hormonal thing. You will get a number of spectrums during pregnancy. There are women who don't want a man to come near them when they're pregnant. The man smells and they have no desire for sex at all. And then there are those that would want a man all of the time because of pregnancy. And these are hormonally mediated situations. So there is no problem as far as that is concerned. But I'm worried about what she called bleeding. She bled at some stage following sex. Now, yes, if you bleed during intercourse and you are pregnant, for that matter, it means that pregnancy is at a threat of being lost. Now, if you have a threatened miscarriage, then sex might actually worsen things. Because during sex, what are the things that happen that can lead to you losing the baby? 1, when there is friction between the penis and the cervix, there is a release of certain chemicals known as prostaglandins. The prostaglandins are the same drugs that we use or the same chemicals that we give to women when we want to initiate labor and also when we terminate pregnancy. That tablet that is given to women when they want to terminate pregnancy is a prostaglandin. And also when we induce labor, we give them prostaglandins. So these prostaglandins, although originally they were believed to come from the prostate gland, we now know that even the cervix have these chemicals. They cause contractility of the uterus and can lead to you going into labor or having a preterm labor or even a miscarriage. And particularly if you have been having a threat to lose that pregnancy. 2, during orgasm, when the women experience orgasm, one of the things that happens is that the uterus contracts. So orgasm can also lead to you losing the pregnancy if that pregnancy is unstable. But in the majority of instances, this is not a problem. Many women will experience orgasm during pregnancy with no threat to their babies. And even those prostaglandins that we talked about. So I must not be misconstrued to say people must stop having intercourse because they can lose the pregnancy. This is only in those people who had a threat to losing their pregnancies, particularly in the first trimester.
Okay. We are discussing all things gynecology by taking all of your gynecology-related questions with our resident gynecologist, Dr. Maluleke. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212. Our voice note number is 060-771-5107, 060-771-5107. You can also give us a call as we continue with this conversation after the break.
Have your say. Call us now on 015-151-1058.
Energy FM and Choice FM care with the COVID-19 alert. To prevent the spread of COVID-19, clean your hands often. Use soap and water or an alcohol-based sanitizer. Maintain a safe distance from anyone who is coughing or sneezing. Wear a mask when physical distancing is not possible. Don't touch your eyes, nose, or mouth. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention. Stay tuned for more COVID-19 alerts.
Do you want to pay your bills? Buy airtime, transfer or receive money with ease.
I think I misplaced that question about the difficult term to say.
Tesorito.
Do you remember what it said?
No, I just saw I did not hear what was said. I just saw the product.
Also bad. Maybe they'll
Dial star 120 star 151 hash.
They'll report you to the
I'll get in trouble.
to the boss.
I'll get in trouble.
We're sending questions and they are not aired.
Yeah, no, she's selecting.
Yeah, we are being discriminated against. We want our questions to be answered, but they are never addressed.
Spa in Burgersfort
I'll find
has an
it.
amazing
I will
Christmas
have
special
to
just
find
for
it.
you. With their couple's weekend away, valued at 2,300 Rand per couple, which includes return transport from Polokwane, accommodation and dinner. Get to explore Mpumalanga's panorama route, the Echo Caves, Big Shoe, Three Rod Doubles, the Blade Canyon, God's Window, Lisbon Falls, the Potholes and Kraskop Gorge. For more information, call 072-205-0546 right now. That's 072-205-0546. Clifford's Lodge and Spa, your friendly and cool oasis in Burgersfort.
Here in Mzansi, we like attending get-togethers and other types of social gatherings. As we do this, we mustn't forget to wear our masks properly, even among family and friends. Coronavirus is far from over. To those who will be in church, let's not exceed the limit. Lastly, if you can, please attend virtual gatherings for your and everyone's safety. It's not easy, we know, but it's the right thing to do. So continue to follow all the protocols because together we can stop the spread of the coronavirus. The Solidarity Fund, Unity in Action.
Conversations, Mondays to Thursdays, 6:30 to 8:30 p.m.
The time is 23 minutes past 8. This is Conversations on Energy FM 102.1 and Choice FM 101.1. I'm in conversation with our resident gynecologist, Dr. Maluleke. We're talking all things female health. This is how you can get in touch with us. Our WhatsApp text line is 079-295-1212, 079-295-1212, or you can send a voice note to 06077715107, 06077715107. Or you can give us a call. The number to dial is 015-151-1058, 015-151-1058.
Have your say. Call us now on 015-151-1058.
All right, let's go back to the WhatsApp text messages. Good evening, Dr. Rebecca. I've been trying to fall pregnant for the past 2 years, now on the third year. The guy is on dialysis and he already has had kids before. Is there a reason that he is on dialysis that it is affecting his fertility? What are the chances of us having kids?
Right. When he's on dialysis, one assumes that he's suffering from chronic kidney failure. Now, our bodies are such that when you have any chronic illness, you are less likely to be fertile. And it is probably a safety measure that when you are not well, you can't be pregnant. And the same would apply to a man who is on dialysis. It is probably the reason why he is not able to make her pregnant, because whatever is causing the dialysis, remember that kidney failure by itself is not the actual disease per se. There are reasons why people have kidney failure. He might be diabetic, he might be hypertensive, and all these conditions will affect the normal functioning of the reproductive structures. So we need to find out why he's on dialysis, what is the underlying reason that led to him being on dialysis because of the kidney failure. So unless you address that, there is not likely to be much in terms of success.
Okay. Let's talk to Anonymous on the line. Anonymous, good evening. Welcome to Conversations. Hi, Anonymous. Are you well? Sure, talk to us. Doctor?
Una le mengwe eme kae wena? O thibela ka eng? O thibela ka eng? Go thibela lebaka e be le o tlogela go thibela lebaka e be le eng? O be o mo hweditše bjale a sa le go mara o ime. Yeah, okay.
It's clear, Doctor.
It is clear.
Anonymous, you listen on the radio for the doctor's response, ne? Thanks.
One is trying to tie things together here. She's not on contraception. She's not falling pregnant. And she's got irregularity of her cycle. And clearly, there is a problem there, which would lead to her having the kind of problem that she's having. Right. Assuming that the man is well and that maybe she's got normal tubes. Abnormality of ovarian function, once again, would be the reason why she's experiencing what she's experiencing. Having stopped the injectable for more than 2 years, it's very unlikely that this could be the side effect thereof. Therefore, this couple needs to be investigated. Firstly, to find out why her cycle is behaving the way it does. And secondly, to try and find the reason why they are not conceiving.
Okay. I'm all right. This listener just literally deleted their message before I could read it. Hi, I'm 32 and have 3 children. I had retained placenta twice. I want to sterilize. Is it expensive at the gynecologist? Second question, during sex, I do have enough foreplay with my girlfriend, but when I penetrate, she tells me to finish quickly during sex. Does it mean she doesn't enjoy me?
Right. This is a man who's asking.
Yes, I'm imagining this question on behalf of the partner first, because it's 2 questions from one person.
Yeah, but when he says we've got 3 children and I want to sterilize, is he talking about himself or he's talking about the lady?
I think he's asking for the lady, and then the second question, that's him asking.
Oh yes, the first question has a placenta, by the way, inside. So it is a woman who has had 3 children and she has had placenta retained twice, and she wants to know if sterilization can be done. The answer is yes, she can sterilize. Now, the second question says when he has intercourse with her, she asks him to finish quickly. It's very strange. It's very difficult for one to find the reason why this is so. There are a number of reasons why indeed she may feel that way. It could be indeed that they've got relationship issues and therefore she doesn't feel him anymore. And sex for her becomes unpleasant and she wants him to get it over with and done. Or it could just be that she's got pain during that process of intercourse. There are a number of reasons why women can have pain, especially at penetration, which is what we call superficial dyspareunia. The commonest one would be inadequate lubrication. The second would be the presence of infection, thrush being the commonest one, or any other sexually transmitted infections, or the fact that she might be having vaginismus, which is involuntary contraction of the pelvic floor muscles and vaginal muscles, and also the one that we've mentioned, that she's not into him at all, and she wants this process to be over and done with.
Okay. Doctor, that is our time. Kindly share your contact details.
We are at 72A Compensati Street in Polokwane, 015-295-9407 or 295-9419.
Thank you very much, Doctor. Our next appointment is next week, Thursday.
Thank you and good night.
That is our time on Conversations. Coming up next is Night Flight with Matumo Managa. A big thank you goes to the show's technical producer, Emmanuel Gwinda, for making sure we sound as good as we do, and to you for always listening and interacting with us. I am Rebecca Pala. Enjoy the rest of your evening. Stay safe.
We keep the hot songs coming on Energy FM and Choice FM.
Shem, somebody is even asking if you know the family of that young woman.
On the Night Flight.
Which one?
The family of the young woman. The one we spoke about in the beginning.
I don't remember.
The young woman with what?
Oh yes,
Yeah.
Tata. Economy njani?